All right, nursing students, are you ready?
Ready for what?
For a deep dive into some serious stuff,
Yeah.
we're talking emergency temperature management.
Oh, yeah, that's important stuff.
That's right, we're going to be covering heat stroke, frostbite, and hypothermia. You know, those situations where your quick thinking and actions can really make a difference for your patients.
Absolutely. Knowing what to do in those situations is crucial. So let's dive in and get you prepared to handle them like a pro.
Okay, so first up, heat stroke. Imagine this. You're at a summer marathon, super hot day, and you see a runner just collapse.
Oh, no.
Yeah, they're burning up, their skin's hot, but they're not sweating at all. And that's heat stroke, folks, a real medical emergency.
It sure is. And it can be really scary because it can come on so suddenly.
Right, and it's not just feeling really hot. It's a complete failure of the body's natural cooling system.
Exactly. Their core temperature skyrockets above 104 degrees Fahrenheit. That's 40 Celsius because the body just can't keep up.
Wow, so the body's internal thermostat is basically broken.
Pretty much, yeah. And there are actually two main types of heat stroke to be aware of, exertional and non-exertional.
Okay, so what's the difference?
Well, exertional heat stroke, that's when someone pushes themselves way too hard in the heat, like athletes or people working construction.
Makes sense.
And non-exertional, or what we sometimes call classic heat stroke, that's more common in folks who are already a bit more vulnerable, like older adults or young children, and it often happens during heat waves.
So exertional is from pushing too hard, and non-exertional is more about prolonged exposure.
Exactly. And that's an important distinction for nurses because it helps you figure out the cause and how to treat it.
Right, so you can tailor your assessment and care plan.
Exactly. Now imagine you're caring for an elderly patient during a heat wave. They may not feel thirsty as often, some meds can mess with their temperature regulation, and they might have health conditions that make them more susceptible to heat.
So many risk factors.
Right, it's a perfect storm. That's why it's crucial for nurses to be extra vigilant with certain patients.
Absolutely. Okay, so what are the signs we should be looking out for?
There are three main things, really. First, you want to look for any changes in their mental state.
Okay, like confusion or agitation.
Right, or even seizures or coma in severe cases. If their mental state is off, that's a major red flag.
Definitely, that's something you can't ignore.
The second thing is anhidrosis, which is the absence of sweating.
Wait, so they're not sweating even though they're really hot?
Exactly. You'd think they'd be drenched in sweat, but often it's the opposite.
Wow, that's counterintuitive, but super important to remember.
It is. And then, of course, the third sign is that high temperature, 104 degrees Fahrenheit or higher.
Okay, so altered mental state, no sweating, and high temp. Those are the big three.
You got it. You might also see other things like a rapid heartbeat, hot and dry skin, nausea, vomiting, even muscle cramps.
So many potential symptoms.
Right, but those three are the hallmark signs of heat stroke, so watch out for those.
So we have to be ready to recognize these signs and act fast.
Absolutely. The sooner you catch it, the better.
Okay, but preventing heat stroke is even better than treating it, right?
You're telling me. And as nurses, you'll be on the front lines of preventing heat stroke.
How so?
Well, you'll be educating patients on how to stay safe in the heat, making sure they drink plenty of fluids even before they feel thirsty.
Right, staying hydrated is key.
It is. You'll also want to encourage them to avoid strenuous activity during the hottest parts of the day.
And if they do have to be out in the heat,
Find some shade, wear light clothing, and use fans or air conditioning to stay cool.
good advice, especially for us nursing students running around between classes and clinicals.
Definitely, you got to practice what you preach. And don't forget about those vulnerable folks. Check in on your elderly neighbors and relatives during heat waves.
Make sure they're staying cool and hydrated.
Exactly. Those little things can be life-saving.
It's all about looking out for each other.
That's right. But even with prevention, emergencies still happen.
So what do we do if we encounter a patient with heat stroke?
First things first, call 911.
Of course, heat stroke is a 911 situation.
Every second counts, so while you're waiting for the paramedics, get that person to a cool place, ASC, and start cooling them down any way you can.
Okay, like what?
Like removing excess clothing, spraying them with cool water, or putting wet cloths on them while fanning them.
So evaporative cooling.
Exactly. You can also use ice packs on areas like their neck, armpits, groin, places where the blood vessels are close to the surface.
Okay, and what about cooling blankets?
Definitely, if you have one, use it. The faster you can lower their body temperature, the better their chances are.
So it's really all hands on deck.
It is. And while you're doing all that, the paramedics will be on their way, ready to provide more advanced care.
So they'll be monitoring vital signs.
Constantly, yeah. Heart rate, breathing, temperature, all that. to see how the patient's responding to the treatment.
And they'll probably start 5E fluids too.
Most likely to combat dehydration and support their circulation.
Okay, so it's really a team effort.
It is, and your actions in those first few minutes can truly be life-saving.
Wow, heat stroke is serious business.
It is, but I think you're ready for it.
I feel much more prepared now. Okay, that was heat stroke. Now let's move on to something a bit colder. Literally.
You mean frostbite?
Yep, frostbite. Imagine you're on a winter hike. Beautiful scenery. But your fingers are starting to turn white and numb.
Oh.
That's frostbite, and it can be just as dangerous as heat stroke.
It sure can. We're talking about the actual freezing of skin and underlying tissue.
So the tissue is actually starting to freeze.
Yeah, and it can happen surprisingly quickly, especially if it's windy or wet out.
And I'm guessing inadequate clothing doesn't help.
Definitely not, especially for people experiencing homelessness. That's a huge risk factor. We as nurses need to be mindful of the social factors that can affect our patients.
Absolutely. Now, I know frostbite progresses in stages, right?
It does, yeah. It usually starts with numbness, tingling, maybe a burning sensation.
So those early signs are really important to catch.
Crucial, yeah. As it gets worse, the skin turns white, gets hard, and you lose all sensation. Then when you start warming up, it turns red and can be super painful.
And in really severe cases.
You can get blisters, tissue death, even gangrene, which could lead to amputation.
Yikes. So catching it early is essential.
Absolutely. Okay, let's say you have a patient come into the ER with frostbite. What do?
Well, based on what we learned about heat stroke, I'd say get them out of the cold and remove any wet clothing.
You got it. First things first, got to stop that exposure to cold. Then you need to rewarm the affected area, and the best way to do that is with warm water.
Warm water, okay. Not hot.
Exactly. Not hot, that can cause more damage. The ideal temperature is around 37 to 40 degrees Celsius, which is about 98.6 to 104 Fahrenheit.
Got it. And I imagine pain management is important during this process.
Absolutely. Rewarming can be very painful, so we want to make sure they're comfortable. And here's something important to remember. Never rub or massage the frostbitten area.
Why not?
Because that can actually cause more damage to the tissue.
Okay, noted. Gentle handling is key.
Exactly. Okay, we've talked about heat, we've talked about cold, but there's another temperature-related emergency we need to cover.
You mean hypothermia?
That's the one. It's not just feeling cold, it's a dangerous drop in core body temperature below 95 Fahrenheit or 35 Celsius. It can be fatal if left untreated.
Wow, that's scary.
It is, and it can happen more easily than you think, especially if you're exposed to cold for a long time, especially if you're wet.
Like falling into a frozen lake.
Exactly. Cold water immersion is particularly dangerous.
So it's important to be aware of the risks and dress appropriately for the conditions.
Exactly. And remember, certain people are more susceptible to hypothermia, like older adults, infants, and people with chronic health conditions.
So we need to be extra vigilant with those patients.
Absolutely. Now, in a hypothermia emergency, what's the first thing you should do?
I'm sensing a pattern here.
Call 911.
You got it. Always call for help first. Then focus on the ABCs: airway, breathing, circulation, just like with any other emergency.
Okay, what about after that?
Get the person out of the cold and remove any wet clothing. Then you need to start rewarming them, but it's got to be done carefully and gradually to prevent shock. I see. So no sudden temperature changes.
Right. There are two main approaches. Passive external rewarming, which is using warm blankets and stuff like that, and active core rewarming, which involves things like warm Hy-V fluids and warm humidified oxygen.
Okay, so passive rewarming is gentler, and active rewarming is for more severe cases.
You got it. And you always want to monitor them closely during rewarming, watch their blood pressure, heart rate, and look for any signs of complications.
Like rewarming shock.
Exactly. That's when their blood pressure suddenly drops during rewarming. Hypothermia can also cause blood clotting issues and electrolyte imbalances.
Wow, it really throws the body out of whack.
It does. And remember, frostbite and hypothermia often happen together, especially in really cold conditions.
Makes sense, they're both caused by exposure to cold.
Right. And if you're dealing with both, remember that hypothermia is the more immediate threat, so address that first while also managing the frostbite.
So prioritize the life-threatening condition first.
Exactly. You'll learn more about all this in your clinical rotations, but it's good to have a basic understanding now.
Definitely. This has been incredibly helpful.
Glad to hear it. Now let's dig a little deeper into some of these concepts. And you know what's fascinating about heat stroke? That whole no sweating thing really throws people off.
It is pretty counterintuitive, right? You'd think someone with heat stroke would be sweating like crazy.
Exactly. But remember, their body's cooling system has completely shut down. It's not just that they're not sweating enough, they might not be sweating at all.
So you see someone who's overheated, confused, has a high temperature, but their skin is dry. That's a major red flag.
Huge red flag. It means their body can't regulate its temperature anymore, and that's when things can get really dangerous really fast.
So as nurses, we can't just rely on what the patient tells us. We have to really use our assessment skills.
Absolutely. Don't just ask, are you sweating? Actually feel their skin. Is it hot and dry? Or are they sweating a lot? That one detail can make all the difference.
It's a good reminder that those hands-on assessments we learn in nursing school are super important. We need to trust our senses.
Exactly. And remember, heat stroke can affect anyone, but some folks are more vulnerable than others.
Like we talked about before, older adults and young children.
Right. Their bodies aren't as good at regulating temperature. So as nursing students heading into pediatrics, gotta be extra careful with the little ones, especially during summer.
Keep them cool and hydrated. No playing outside during the hottest part of the day.
Exactly. And don't forget about athletes. They push their bodies to the limit, often in the heat.
Right. They're at high risk for exertional heat stroke.
They are. So we can play a role in educating coaches and athletes about preventing heat illness.
Like making sure they take frequent breaks, stay hydrated, and gradually acclimate to the heat.
Exactly. It's all about being proactive.
Now, you mentioned earlier that certain medications can interfere with the body's ability to regulate temperature.
Oh yeah, that's a big one, especially for older patients who are often on multiple medications.
So what kinds of meds are we talking about?
Well, things like diuretics, antihypertensives, and anticholinergics, those can all affect sweating and temperature regulation.
So it's not just the heat itself, it's the combination of heat and these medications.
Exactly, and that's why medication reconciliation is so important.
Making sure we know what meds our patients are taking and understanding the potential side effects.
Right, and educating patients about the risks of heat exposure if they're on those meds.
So we might advise them to take extra precautions during hot weather.
Exactly, it's about empowering patients to take care of themselves.
Okay, that's a lot of great information about heat stroke. Now, let's switch gears back to frostbite for a bit.
Back to the cold.
We talked about frostbite being the freezing of skin and tissue, but I know there are different levels of severity, right?
You're right, it's not all the same. We categorize frostbite into 4 degrees based on how deep the freezing is and how long the exposure was.
Okay, so walk me through those different degrees. What should we be looking for?
Sure. 1st degree frostbite, that's the mildest form. It only affects the surface of the skin.
So what does it look like?
You might see some redness, some swelling. The area might feel numb or tingly.
Kind of like a mild sunburn.
Yeah, something like that. And luckily, 1st degree usually heals on its own without any lasting damage.
Okay, that's good to know.
But as we go up the scale, things get more serious. 2nd degree frostbite, that involves deeper layers of skin.
So what happens then?
You start to see blisters forming, and the skin might turn this waxy white color.
So that's when we start to worry about long-term damage.
Right. With 2nd degree, there's a risk of scarring and maybe some loss of sensation in the affected area.
Okay, what about 3rd degree?
3rd degree, the freezing goes all the way through the skin and into the tissue underneath.
Ouch.
Yeah, the blisters get bloody, the skin turns bluish black. It's not pretty.
And that's when the tissue damage becomes really serious.
Right, there's a much higher risk of complications with 3rd degree frostbite.
And then there's 4th degree, the most severe.
With 4th degree, the entire area freezes solid bones, muscles, tendons, everything.
So basically the tissue dies.
Pretty much, yeah. And unfortunately, there's a very high risk of gangrene and amputation with 4th degree frostbite.
That's a scary thought.
It is, and it highlights why early recognition and treatment are so crucial.
To minimize the damage and prevent those worst case scenarios.
Exactly. And remember, rewarming a frostbitten area can be really painful for the patient.
So pain management is super important.
Absolutely. We want to make sure they're as comfortable as possible while we're rewarming those tissues.
And we talked before about not rubbing or massaging the frostbitten area.
Right, that can cause more harm than good. Gentle handling is key.
Okay, so warm water, pain meds, gentle handling. Got it.
Now let's shift back to hypothermia for a bit. We talked about rewarming carefully, but I know there are different ways to do that, right?
Yeah. What are the different rewarming methods?
Well, we already talked about passive external rewarming, which is the simplest approach. Think warm blankets and stuff like that.
The warm cocoon method.
Yeah, exactly. But for more serious cases, we might need to use active external rewarming.
What's that?
That's where you apply heat directly to the skin, like using heating pads, warm baths, or forced air warming blankets.
So that helps warm the body up faster.
It does, but you have to be careful because it can cause a sudden shift in blood flow, and that can lead to problems.
So we need to monitor them very closely.
You bet, especially their blood pressure. And then there's the most aggressive method, active core rewarming.
Which is for the most severe cases.
Exactly. That's when we deliver heat directly to the internal organs, warm OIV fluids, warm humidified oxygen, and in really dire situations, things like peritoneal lavage or even cardiopulmonary bypass.
Yeah, that's getting into some serious medical interventions.
It is, but sometimes it's necessary to save a life.
It really shows how dangerous hypothermia can be.
It does. Now, we mentioned earlier that hypothermia can cause blood clotting problems and electrolyte imbalances. Can you explain those a bit more?
Sure. When your body is exposed to extreme cold, it can affect how your blood clots, making you more prone to bleeding.
Interesting.
And the cold can also mess with the balance of electrolytes in your body, like sodium and potassium.
Which are super important for your heart, muscles, and nerves to function properly.
Right, so those electrolyte imbalances can lead to all sorts of problems, like dangerous heart rhythms.
Makes sense. It's like the cold throws your whole body out of whack.
Exactly. Now, we know that older adults and young children are more susceptible to hypothermia, but what about people with chronic health conditions?
They're definitely at increased risk too. Their bodies might not be as strong and able to handle the stress of extreme cold.
So people with heart disease, diabetes, respiratory problems, we need to be extra careful with them.
Absolutely. And we have to be mindful of their medications too. Some meds can make them more vulnerable to cold.
It's all about understanding the individual needs of each patient.
Exactly. And what about people who work or exercise outdoors?
Right, they're exposed to the elements all the time, so they're at higher risk as well.
They are, so it's crucial for them to take precautions, stay hydrated, dress warm, take breaks in warm places.
And it's not just about the temperature on the thermometer, right?
Yeah.
Wind chill and humidity can make it feel much colder.
You got it. We need to educate our patients about these risks so they can make good decisions about their safety.
Now, we've focused a lot on the physical effects of hypothermia, but I'm curious about the psychological effects.
Yeah, that's an important aspect too. Extreme cold can definitely take a toll on mental health.
How so?
Well, hypothermia can cause apathy, lethargy, and even impaired judgment. It can be hard to think straight when you're that cold.
So as nurses, we need to be aware of these psychological symptoms and provide support.
Exactly. And remember, those effects can linger even after they've warmed up physically.
So it's about addressing their emotional and mental well-being as well.
It's about holistic care, looking at the whole picture.
Now, I'm wondering about the role of technology in managing these temperature-related emergencies.
Ooh, good question. There are actually some amazing tools available now.
Like what?
Well, we have temperature monitoring devices that can alert us to changes in a patient's body temperature, even remotely.
Wow, so we can keep tabs on them even when they're not right in front of us.
Exactly. And there are new rewarming techniques being developed, like ECMO, extracorporeal membrane oxygenation, that can warm the blood of severely hypothermic patients.
That sounds pretty high-tech.
It is, but it's also life-saving. These advancements help us intervene faster and more effectively.
It's amazing how technology is changing healthcare.
It is. But even with all the technology, prevention is still the best medicine.
Absolutely. So let's go over some of those prevention tips again. For heat, what can we tell our patients?
First and foremost, stay hydrated. Drink plenty of fluids, especially water, even before you feel thirsty.
Okay, stay hydrated. What else?
Avoid strenuous activity during the hottest part of the day. If you have to be outside, find some shade and take breaks.
And wear loose-fitting, light-colored clothing.
Right, and if you start to feel overheated, take a cool shower or bath, or put cool compresses on your skin.
Good tips. And don't forget to check on those vulnerable folks during heat waves.
Right, make sure they have access to cool spaces and are drinking enough fluids.
It's all about looking out for each other.
Okay, now for preventing frostbite, what's the most important thing?
Dress warmly.
You got it. Layers are key, and make sure all exposed skin is covered.
No showing off those ankles in the winter.
Nope. And pay attention to the wind chill. It can make it feel much colder than it actually is.
It can be deceiving, that's for sure.
And if you're going to be outside for a while, take breaks in warm areas so you don't get too cold.
What if you start to feel numb or tingly in your fingers or toes?
Get inside and warm up immediately. Don't ignore those early warning signs.
Got it. Be proactive and dress warm.
Exactly. Now, we've talked about protecting ourselves, but what about our homes?
Good point. How can we prevent temperature-related problems in our homes?
Make sure your home is properly insulated. That helps keep the heat in during the winter and out during the summer.
So good insulation can protect us from both extremes.
Exactly. And have your heating and cooling systems checked regularly to make sure they're working properly.
Easy to forget about those until they break down.
It is. And if you use space heaters, be super careful. Keep them away from anything flammable.
Space heaters can be a fire hazard if you're not careful.
No kidding. Safety first. Okay, let's talk about first aid for a minute. What should people do if they think someone has heat stroke, frostbite, or hypothermia?
Well, I think we all know the answer to this one. Call 911.
You got it. Always call for help first. These are serious conditions that need immediate medical attention.
So don't hesitate. Better safe than sorry.
Absolutely. And while you're waiting for help to arrive, there are a few things you can do.
Like what?
For heat stroke, move them to a cool place and start cooling them down any way you can.
Remove clothing, fan them, cool compresses, all that.
Exactly. And if they're awake and can drink, offer them cool water or a sports drink.
What about frostbite?
For frostbite, take off any wet clothing and gently rewarm the area with warm water. And remember, no rubbing or massaging.
Right. Gentle handling.
And for hypothermia, get them out of the cold and into a warm environment.
Take off any wet clothes and wrap them in blankets.
You got it. And if they're conscious and can swallow, give them something warm to drink, but no alcohol.
Okay, so basically, get them warm and dry as quickly as possible.
Exactly. But remember, these are just first aid measures. They're not a substitute for professional medical care.
Right. The most important thing is to get them to a doctor.
Absolutely. Now, are there any other resources that might be helpful for nursing students who want to learn more about these topics?
Good question. I know the CDC has a lot of information on their website.
The CDC is a great resource for all kinds of health information.
And the American Red Cross offers first aid and CPR training.
Those are essential skills for any nurse. And don't forget about your local hospital or health department. They often have programs and resources too.
So lots of great resources out there.
There are. And as future nurses, you can be advocates for these resources and make sure everyone in your community has access to them.
That's a great point. It's about sharing what we know and helping create healthier communities.
Exactly. Okay, we've covered a ton of information today, but I feel like we've only scratched the surface.
There's always more to learn, especially in nursing.
That's the beauty of it. It's a lifelong journey of learning and discovery.
So stay curious, keep asking questions, and get ready for the final part of our deep dive where we'll wrap up this fascinating topic. So much good info about emergency temperature management. I feel like a pro already.
You're getting there. And once you start your clinical rotations, you'll see all this knowledge come to life in real patient situations.
Yeah, I can't wait to put it all into practice.
It's an exciting time.
Yeah.
And speaking of real-world nursing, there's one crucial aspect we haven't talked about yet. Documentation.
Ah, yes. Charting, not the most glamorous part of nursing, but definitely important.
It's super important, especially in emergency situations. Accurate documentation can be crucial, especially if there are ever any legal questions later on.
So it's not just about doing the right things, it's about recording them properly.
Exactly. Your notes tell the story of the patient's care you need to paint a clear picture of what happened, what you did, and how the patient responded.
Like a step-by-step account of everything.
Exactly. So let's say you're dealing with a heat stroke patient. What are some key things you need to document?
Well, I guess you'd start with the basics, like the time of the incident, where it happened, the weather conditions.
Right, all that important context. And then get specific about their symptoms. What was their level of consciousness? Were they confused? What was their temperature? Were they sweating or not?
And of course, we have to document all the interventions we did.
Absolutely. Every single thing you do to cool the patient down needs to be recorded. The methods you used, how long you did them, and the patient's response.
Did their temperature go down? Did their mental state improve?
All those details are important. You're basically building a case showing that you are thorough and responsive to the patient's needs.
That's like detective work.
Kinda, yeah. And don't forget to document any meds you give, IV fluids, vital signs, everything.
It's a lot to keep track of.
It is, but you'll get the hang of it. Your clinical instructors will be there to guide you.
That's good to know. Now, this might seem obvious, but make sure your documentation is legible and uses proper medical terminology.
No, yeah. Nobody wants to decipher chicken scratch, especially in an emergency situation.
So clear, concise, and accurate is key.
Exactly. And be objective in your charting. Stick to the facts, avoid personal opinions, use neutral language.
Okay, so no editorializing in the medical record.
Nope. And these same principles apply to documenting frostbite and hypothermia cases too.
So capture the extent of the injury, the rewarming methods, pain management, any complications.
Exactly. All the important details. And don't forget about patient education. Document any instructions you give the patient about preventing future problems.
Right, like telling them how to stay safe in the heat or cold.
Exactly. That shows you're going the extra mile to empower your patients.
It's all about being that advocate for them. Now, we've talked a lot about managing these emergencies in a hospital setting, but what if you're the first responder, like out in the wilderness or at a sporting event?
That's when your quick thinking and those basic first aid skills we talked about really come into play.
So we might have to get creative with our cooling or rewarming methods.
Exactly. You might not have ice packs, so you might have to use cool water from a stream or snow packed in a cloth.
That's resourceful.
And for rewarming, body heat can be surprisingly effective. Huddling together for warmth can actually make a big difference.
That's like those survival shows where they have to improvise all the time.
It is. And just like on those shows, staying calm and reassuring the patient can make a world of difference.
Right. Our communication skills are just as important as our clinical skills in those situations.
Absolutely. Your demeanor can be the most powerful intervention sometimes.
I never thought about it that way, but it makes sense.
It's all about staying calm and projecting confidence, even when you're feeling stressed.
So much to learn, but I feel like I'm getting there.
You're well on your way to becoming a fantastic nurse. Remember, it's all about combining your knowledge, critical thinking skills, and the ability to act quickly.
And never stop learning.
Couldn't agree more. This is just the beginning of your nursing journey.
That's exciting and a little bit daunting.
It is, but embrace the challenge. And remember, you have the power to make a real difference in people's lives, especially in those moments when every second counts.
Well said. Thanks for joining us for this deep dive into emergency temperature management. We hope you feel more prepared to handle these situations as future nurses.
It was my pleasure. Now go out there and make us proud.
That's a wrap for today's deep dive. Catch you next time for another exciting topic in the world of nursing.